this vaccination is done every 3 years. Basically, you do this vaccination every 1 to 3 years to prevent the infection from this microorganism. And you have also vaccination with typhoon V for against typhoid. Basically, so those are the different elements that you have to know in the prevention of the infections. So after the infections, now still in the abdomen, you're going to have the kidney. You have renal failure. Basically, and renal failure is going to be via a mechanism called the renal papillary necrosis. Basically, renal failure is via the mechanism called renal papillary necrosis. Now let's explain what happened in renal papillary necrosis. I've already explained on the tutorial on the renal failure that you are going to have what is called, you have here the glomerulus, and then you have the proximal convoluted tubules, the loop of inlet, distal convoluted tubules, like this. Basically, let's go very fast. Now you need to know that what at the level of the glomerulus, at the level you are going to have the afferent arteriole that supplies the glomerulus, then the efferent arterioles moves out. Basically, so now when the efferent arterioles move out, it's going to be divided now to different capillaries, and these capillaries are called the peritubular capillaries. Are you understanding? Divided into different capillaries called the peritubular capillaries. Now you need to know that what perfusion at the level of the glomerulus is very huge. There are three major parts at the level of the kidney. Basically, we are going to have one. The glomerulus is one part at the level of the kidney. The second part at the level of the kidney is the tubules. Basically, and the third part at the level of the kidney is the interstitium. Basically, so those are the three main parts at the level of the kidney. Now you need to know that what the glomerulus and the interstitium are highly vascularized. The glomerulus and interstitium are the two major parts which are highly vascularized. The one which is having least of vascularization is the tubules. Why? Because when blood comes in the glomerulus, all the pressure is going to be used for the filtration of the products. Basically, it's going to be used for the filtration of all the filtrate there with the sodium ion, potassium ion, and all that. Basically, so it means that the remaining blood that goes here to perfuse the tubules, is very small. Basically, and the pressure inside this blood is going to be very low. Basically, that's why when you have now sickle cell, in sickle cell you have high viscosity and you have occlusion. So the sickle cell cells are not going to occlude this side here. Basically, because the blood pressure at the afferent arteriole is very high. Basically, so then they are not capable of occluding this side here because the blood pressure at this level is going to be very high. So this occlusion at this side, if the sickle cell occlude at this side here, is going to result to what is called an acute glomerulonephritis or any glomerulonephritis, because it occludes at the level of the glomerulus, but it cannot here because the blood pressure is going to be very high. But now the sickle cell are instead going to occlude at this level because here the blood pressure is not going to be very high. Basically, since they occlude at this level, you are going to have a tubular necrosis, basically, and papillary necrosis. All these tubules are papillae, basically. So that's why you have what is called a renal papillary necrosis, which is a mechanism for which tubules are being destroyed. Basically, another mechanism via which tubules can be destroyed is that in cases of sickle cell, you are going to have also excessive hemolysis, and that excessive hemolysis can result to the release of hemoglobin, and the hemoglobin now is going to seal the tubules by a mechanism of the toxic acute tubular necrosis. You see that the tubules are the one that are still going to suffer in the case of sickle cell. Basically, so you can destroy sickle cell both by ischemic acute tubular necrosis, which is called acute tubular necrosis, or you can still destroy by toxic acute tubular necrosis. All of it is called renal papillary necrosis mechanism of acute kidney disease. And now when you have renal papillary necrosis, you need to know that the interstitium which are slightly here are the one that are supposed to concentrate urine. So in the case of a chronic renal papillary necrosis, that's why through children that are sickle cell are going to have excessive urination, is equal. So their renal failure presents with excessive urination because of inability to concentrate the urine. You have polyuria, is equal, and you have also enuresis. That is the bed wet, is equal. Now we have other complications. So we continue with the other complications. So that's for the abdomen. After the abdomen, for the liver, we have gallbladder stones. Gallbladder stones because we have excessive. Number 11, we have gallbladder stones because we have excessive production of bilirubin, excessive hemolysis with the excessive production of bile to produce gallbladder stones. Number 12, we are going to have things like a chronic leg ulcer. We have chronic leg ulcer, and we have chronic leg ulcer because of reduced perfusion of the lower extremities. Number 13, the 13th one is that you have avascular necrosis of the humeral and the femoral head. Is it clear? Avascular necrosis of the humeral and the femoral head, because the humeral and the femoral head are one of the major organs that has a retrograde perfusion. Is it clear? The retrograde, and also even at the level of the lunate bone, is it clear? They have a retrograde perfusion. Since they have retrograde perfusion, they can be easily occluded. Is it clear? So those are some complications. The next complication you have at the level of the penis, where you have priapism. Is it clear? When you have priapism, and at the level of the priapism, you need to know that one. Generally, for you to have an erection, you need to know that the mechanism is that for you to have an erection, is it clear? For you to have an erection, you need to know that there is a blood vessel that is going to perfuse at the level of the penis, and the blood vessel that is going to drain the penis. Is it clear? Now, in cases of priapism, what happens is that there is occlusion of the blood vessel that drain the penis. So there is accumulation of blood inside the penis. Since there's accumulation of blood inside the penis, you are going to have excessive erection, and that erection is also going to be painful. Is it clear? So in order for you to stop it, we are going to speak about that in the management. But generally, you need to know that you have to remove the blood in this corpus cavernosum. Is it clear? You need to remove the blood in this corpus. So you take the blood, you pour away. You take the blood, you pour away, such that you can remove the blood in this corpus cavernosum and reduce the erection. And also, you can also use adrenaline. Is it clear? To occlude the corpus cavernosum, such that blood cannot penetrate inside. But that one is the last step. Is it clear? But the best thing is just to remove the blood inside the corpus cavernosum for the patient not to suffer again. Now, the next thing, or do exchange blood transfusion and place it in another route. The next thing after that we are going to speak about now is the clinical presentation of these patients.